Hello everyone. We are going to talk about another drug in pharmacology, beta-lactam antibiotics. Beta-lactam antibiotics include penicillin and cephalosporin. We will look at penicillin. Penicillin is produced by a bacteria or developed from a bacteria called Penicillin nonatorium and Penicillin chrysogenum. They are classified as follows: narrow spectrum penicillin, example benzyl penicillin, phenoxymethyl penicillin. These are examples of narrow spectrum penicillin. Then we have broad spectrum penicillin, example amoxicillin and penicillin. Then we have penicillinase resistant penicillin, example oxacillin, clozacillin. Then we have anti-pseudomonas penicillin, example carbapenicillin, ticagrelin, and papiracillin. We'll look at the penicillins. The class of this drug, the antibiotics. Classification is antibiotics or penicillin. Example of these drugs, since they fall under the same class, we will treat them as a drug because they have the same mode of action, the same indication, contraindication, side effect, and nursing implications. The penicillin, example of penicillin that are common include amoxicillin, clozacillin, ampiclox, augmentin, that is amoxicillin plus clavunate. The mode of action: penicillin acts by interfering with the synthesis of peptidoglycan layer of the cell wall, which normally protects the bacteria from its environment. Peptidoglycan, that is, the cell wall is made up of protein and carbohydrate, which is known as peptidoglycan layer of the cell wall. Due to differences in the osmotic pressure, the bacterial cell wall swells and explodes after taking these drugs. It destroys or it interferes with the synthesis of peptidoglycans, which usually make the wall to swell and then break. Indication: what condition do you use this drug for? Pneumonia, meningitis, gonorrhea, otitis media, sinus infection, urinary tract infection, streptococcus and staphylococcus infection, syphilis, anthrax, yawns, diphtheria, skin and soft tissue infection, septicemia, and many others. It is also used for a patient that is having wound on the skin, any wound on the skin. When it kills the bacteria on the skin surface, the wound heals faster. The drug usually comes in in ointment form, capsules, injectables, which is usually in form of vial. The contraindication: hypersensitivity to penicillin. Patients that react to penicillin will not take this drug. Cephalosporin. Patients that react to cephalosporin drug should not take this drug. Side effects. Cephalosporin includes ceftriaxone, cefalazine, and so on. The side effects: fever, rash, asthma, anaphylactic shock, hemolytic anemia. Nursing implication. The dosage. 1 capsule of ampiclox, for instance, usually come in 500 milligrams. Depending on the severity of the infection, ampiclox 1000 milligrams is taken for effectiveness. Augmentin comes in different form. Some are 1 gram, some come in 1.2 milligram, and so on. This drug come in syrups, suspension, capsules, and injectables. The nursing implication: ensure that the patient is not hypersensitive to the drug before giving the drug. Make sure the patient doesn't react to the drug before giving the drug. Also, a specimen can be taken for microscopic culture and sensitivity tests before, as the specimen is taken, the drug can be commenced. The third one: give the drug with food to prevent GI, gastrointestinal distress. Monitor the patient closely for signs of superinfection, especially with large doses and prolonged therapy. Advise patient to report immediately if rash, fever, chills occur. Rash is the most common allergic reaction. Advise the patient to report diarrhea. It may be symptoms of pseudomembranous colitis, which may be life-threatening. The various types of penicillin and dosage. We have amoxicillin, which comes, 1 capsule comes in 500 milligrams per oral. The liquid is a powder oral that is dissolved. We have 125 milligrams per ml. Then we have injection, which comes in 500 milligrams in vials by IV. The augmentin comes in 625 milligrams per oral, which is given twice a day. The syrup is half the milligram, or 225 milligrams per ml. The ampicillin injection is 500 milligrams, 1 gram in vial per IV. Ampicillin per oral. Capsule 500 milligrams. Suspension is 125 milligrams per ml. Ampicillin plus clozacillin, that is ampiclox capsule, comes in 500 milligram to 1 gram suspension. We have other drugs like clozacillin, which comes in 500 milligram, flucloxacillin, and procaine benzene penicillin. Thank you for listening. Always watch, subscribe, and comment. Thank you.